So these next couple of videos are going to be about DOHaD, which is the developmental origins of health and disease. This is the concept that the origins of lifestyle-related diseases formed at the time of fertilization, embryonic, fetal and neonatal stages by the interrelation between genes and the environment. The risk of disease in adulthood is sort of like pre-programmed during a specific developmental events, and adverse environments can disrupt this normal fetal growth and development. Some examples being altered epigenetic programming of cell and tissue differentiation, gene expression or protein regulation, so functional changes, tissues or cells that look normal but are metabolistically abnormal, which results in a permanently altered function. These changes persist without life and can cause adulthood diseases such as metabolic diseases and cardiovascular diseases. A key study in this sort of area is the Barker study. So this was done in the 1980s by David Barker, and he developed the DOHaD hypothesis. A good quote is, "The womb may be more important than the home." He found that neonatal deaths were associated with low birth weight, suggesting that the intrauterine environment was to be researched rather than the childhood environment. And he also linked fetal and infant growth with cardiovascular disease through the study. So 449 men and women born in the same hospital in Preston showed that the current blood pressure and risk of hypertension linked to how low their birth weight was. And obviously a low birth weight is then linked to maternal nutrition. So he developed this new model based on the programming of the environment in their fetal and infant life. I'm sorry if you heard a really loud noise then, I just hit my iPad with my pen. But obviously the 1980s was 40 years ago now. 40 years ago. So there's been more recent developments, and we now know that it's not just linked to low birth weight.
There's also evidence of issues due to preterm birth and higher birth weight, and it's also not just limited to the fetal period, so it can there's been results showing that the preconception, early pregnancy and throughout pregnancy and the postnatal period of the first 2 to 4 years can cause an effect on what it's like to develop disease as an adult. So lifestyle-related diseases are diseases linked with the way people live their lives, some examples being Alzheimer's, metabolic syndrome, asthma, heart disease, atherosclerosis, cancer, obesity and stroke. And there are quite a few different risk factors in the lifestyle that can cause these sort of diseases. So you've got your diet, smoking, stress, alcohol, any drugs that you take,